Hey guys, Dr. Michael Derry here, owner of Revision Health Services here in Jacksonville, Florida. And I'm a mobile physical therapist. So I go to people's homes and I treat their pain every day. Now, I specialize and I love to treat in lower back pain. And back pain specifically impacts so many people. And I'm sure you've had back pain in your life, or you know somebody who's had back pain in their life. And when I'm in the trenches treating back pain, I really start to notice correlations and different common patterns between patients and what the evidence is showing. And I want to go over today what I believe the most impactful thing to know about what causes lower back pain. And so I get that question a lot. What caused my lower back pain? Why am I in pain? Like, how did this all start? I get those questions a lot. And when you look at the research and you start seeing these patients over and over again, you start to see some patterns. And I want to go over the number one thing of what I see causing lower back pain. And so if you want to know that, hang with me. Let's go through this video. Let's open up your mind, be open to something new, and just kind of hear it from my perspective from treating people and been through back pain myself. And so number one cause of lower back pain, and hang with me to the end because I've got something else to add in there for you because I want to pick your brain a little bit and learn a little bit more about your experience. And so here we go. I'm glad you're here. I'm glad we're going through this because this is something that I see all the time. What caused your lower back pain? And so let's just start off out of the gate saying it's not from genetics, right? It's not because your grandfather or your mother had back pain. Now, there can be some genetic factor and some conditions out there, but I don't believe it's strong enough to make that big of a difference to say that that's what's caused your lower back pain. So let's just get that out of the way. It's not your genetics. It's not the way that you were built in the factory to cause your specific low back pain in this moment. So I don't see it. The literature isn't super conclusive on it. I don't necessarily believe that being the number one contributor of what caused your lower back pain, because you've had your genetics your entire life and you probably haven't had lower back pain your entire life. And so I'm just not buying it. I don't see a lot of interest in that. If you guys don't agree, then leave a comment in there. If you have some research on something else, please leave a comment with a link. I would love to just continue exposing myself to the latest and greatest research. So let's just figure it out, right? Number two, your low back pain is not caused from exercising or lifting weights. In fact, if you look at the best research for the treatment of low back pain, it says to do those things. All right, that's what makes sense. Like, that's what we need to do. We know that 90% of people have back pain in their life, and about 30 to 50% of people are walking around with achy back discomfort, stiffness every single day, right? So to say that exercises cause that is very much not true. Like, if you look at the number one treatment for back pain and long-term management of back pain and acute management of back pain, it involves some sort of movement, flexibility, exercise, all of that type of thing. Now, with that said, it is kind of individualized, and I've seen people get hurt while exercising, and that really boils down to the number one reason why I think low back pain is caused, and that's being load management. Now, let me explain. So load management is, at a 15,000 foot view, too much, too fast. And so you can think of load being gravity, resistance, and increased pressure. So when you bend over, you have an increased pressure in your back. We know this, we've seen it before, and that makes sense. You have increased pressure in your joints when you use them, just like, 6 to 8 times your body weight when you in your knees, when you do a squat, you have pressure. And so that can be considered load. And so when I see people and they hurt their back doing something in particular, it's a load management issue. And so they did too much too fast. And so if you do ask your body to do that, you need to be equipped to do that. So you need to have that resiliency built in, have that strength built in, and have that threshold of being able to do that activity. And so when I'm working with people, and let's say that they bent over and they felt something in their back when they came up. I hear this often. And so they bent over, picked something up, came back up, ooh, felt something in their back. Too much, too fast. And so when you bend over, you have an increased pressure in your back. You're adding that external resistance of picking something up, and your back wasn't ready in that moment. Maybe you weren't warmed up. Maybe you just didn't have the strength built into your back. Maybe you've done it 1,000 times, but that one particular time just kind of took you over the edge. I see that in my new parents as well, putting their kids in their bed, in their crib, and they start to feel something in their back, and they come back up and their back goes into spasm. And that's a load management issue. Another example of load management, let's see, when you fall, right? You have an increased pressure in your back in that moment, high amount of pressure, and that causes your discomfort. And so again, load management, you've got to be equipped to handle that load. Now a fall is a little bit different, right? You don't necessarily expose yourself to that on purpose. But that's just an example of load management. And so when I see patients like that and they have a load management issue, then that's when we start discussing like, okay, so if you're going to do that, you need to be well equipped to do that. And that well equipped comes from having that resiliency built in. And that's what I help people with. And so what causes your lower back pain? It's that load management for sure. I'm a firm believer of that load management. I don't really get stuck in the weeds. And so what I mean by stuck in the weeds, and I think this is what everybody really needs to know about this, is what causing their low back pain. Man, you could go through a lot of testing and a lot of time to try to figure out, in fact, what caused your lower back pain. That can be a really dangerous path, because not only does it make you mentally like start to question a lot of things, but it makes you spend a ton of money and time and resources on things that you shouldn't spend time and money on. So would you be better off consulting somebody that kind of understands how back pain happens and how to recover, despite what the exact cause is? Because you don't want to get lost in the weeds as a provider and as a patient. You don't want to be spending a bunch of time and money trying to figure out the exact cause. Let's figure out what you're feeling. Let's figure out what were you doing when this happened, or what was going on in your life, what caused this. Figure that out to a level that we can get you started down the right path. Let time in your body do a lot of work, as well as some gentle exercising and mobility work, and then really start diving into building up your resiliency. And so if you do that, you have your load management strategy figured out. You're not getting stuck in the weeds with what caused your lower back pain. And so my number one tip for people trying to figure out what caused your low back pain is just take a step back and just understand that we may not know the exact reason every single time. And that's just something we need to accept. And that's just the way it is, and unfortunately, it'll probably always be like that, because we're dealing with pain. When pain, if you look up the definition, it's a perception of threat to your body. So your body has a pain experience. And so it is definitely an experience. And that's because it's different for everybody. So some people have high levels of pain tolerance or low levels of pain tolerance. And so what caused your lower back pain is probably load management. You probably did too much too quick in some way, shape, or form. My biggest tip to you is don't get stuck in the weeds, and put together that team that's going to help you get better without spending a ton of money and time on things that we shouldn't spend a ton of money on time on, such as figuring out the exact cause. And start from there, and then just start yourself on a path of recovery and be optimistic about it. Just know that you're going to get better, and that absolutely will happen. And so it's not the genetics that you have. It's not from lifting weights. It's just from load management. And you guys can get better. Don't get stuck in the weeds about what caused your lower back pain. Now, if you guys know something I don't, or you have some sort of experience to add, or you just have a comment, just leave it in the comments box. I greatly appreciate that. I love hearing people's story. And the thing is, everybody's back pain is different, and I love just learning more about it. So put it in the comment, subscribe to the channel. I just want to continue having these conversations. And guys, like always, stay healthy, keep moving, and take care of yourself.